And I apologize for my camera. I'm just gonna put it on, but it's just it's not, it's not, the other one's not working.
Gotcha. Okay. And okay, we should be starting. So Desba, the meeting is yours.
Okay, and this means that I can't see everybody, right? They can only see me.
Right, since you're on your phone. Just so everybody is aware, Desba is just is working off of their phone. And so we'll be announcing anything as far as that goes into the chat. We'll relay it from the department standpoint, just so everybody is there. We'll also do that for other people who may be on their phones and not on a computer and don't see the aren't able to see the chat. And just as a quick check before we move forward, can a couple of people who are attendees raise your hand? I just want to check and make sure you can hear us. Okay, perfect. Thank you, Chris. All right. Oh, and Brett and Kate and Brenda and James, thank you all very much. You can put your hands on down. We just wanted to make sure that everyone could hear us and we can move forward. So Desba, and for those who don't know me, I'm Dominic Zerlo. I'm the Center Director for the Medical Cannabis and Psilocybin program at the Department of Health. And I'll just turn it on over to our chair, Desba. Desba, the meeting is yours.
Yeah, it's Aisha Dusba. Hi. So I just wanted to kind of quickly thank you for all being here, especially so quickly after the festivities, and just everything that's been going on. I know if any of you have been at Ian's meeting earlier, thanks to your continued dedication. So just briefly a little bit about this particular committee, or at least what I'm hoping to do here. And also I have another meeting scheduled for next Wednesday at night, I believe from 5:30 to 6:30. It's a little shorter just so it's not interrupting everyone's evening so much. But I also know that some people might not be able to do meetings during the day, and I just wanted to maybe just to do a little safety net catch for those. So if you know of anybody who wanted to come today and not able to attend because of it's so early to the holidays, definitely come in. It'll be the same kind of format. This is more of a listening session where I just want to hear other people's inputs and what their concerns are, what everything is, what they've been doing to work towards equity, access, and in cultural considerations. Um, it seems like it's a very broad and very broad kind of category. But I feel in part that it can have the possibility of being plugged into these different areas because of certain um, overlaps. And that's just kind of where I'm coming at it from. I have had someone concerned saying that we should have specifically for Native American, since I am the Indigenous board member for the advisory group, that there should be a separate Native American um, committee for that. But I'm open to what everybody has to say and their concerns and suggestions, mainly in part because there's just been so much work that everyone has done over the decades, essentially, and beyond in this field. And all of that hard work, I really feel has the opportunity to be moved into what the state is trying to do as far as governance when it comes to use of psilocybin and beyond. Um, and whether or not it can be split up or there's an additional, as far as I believe, Dominic, the board is still looking for two more board members. Is that correct?
That is
Or the
correct, Desba.
process? Okay.
Yeah.
Yeah. And so if anybody, I guess, to reach out into that area of like what's, because I don't also have all the answers. There might be some other people who have more answers or better, more informed as far as like admin policies and those types of things when it comes to how we're moving forward. And we're also just trying to form what we're doing and how these committees are going to be structured, what the primary process is it's going to be, and how it's going to be then shared with the rest of the advisory board when it comes time. I'm going to be touching my phone a lot because I was trying to get my camera set up and it just didn't work today. Um, and um, yeah, so again, I'm just here to listen to what other people's concerns are, what feels like needs to be included, talked about, and established. That being said, just as an example, and I'm just going to throw out a lot of stuff from my perspective and from where I'm coming at. There might be something that maybe I don't personally agree with per se, but as a committee, that something is agreed upon. That is going to, my job to me in essence is that I'm moving that forward. And I'm going to be presenting that along with everybody else as a recommendation or as something that needs to be thought about. My sole purpose in being a part of the board, as far as I'm concerned, is just relaying that information and helping to kind of foster more conversation, thorough looking at what needs to be addressed, and so forth. So that was the main purpose of me joining the board. There's probably several of you that I don't know who don't know me or know my background. So I don't mind kind of giving that. I don't know if anybody really, really wants to go into it. I don't want it to be like too much of a soapbox, but I just wanted to have like an understanding of, I have my own prejudices, I have my own biases, I have my own opinions on things, but that doesn't mean that that's the thing that's going to happen as far as the committee, that's not the agenda. The agenda is to move what is being discussed and what's important as a group forward, and those concerns being relayed and thought about and provided to the rest of the state. Like, this is what we've talked about. This is what we recommend as a group, as a whole. So even though I'm chairing this is mostly just me being a facilitator in that way. And, whether or not some discussions might get, heated, or if something, I really want to have everyone be able to speak freely to the best of their ability. I know maybe that it might feel like that's not possible in some ways sometimes. Just as a throwing that out there, I do have a 13-year-old, so we've had some very heated discussions between my kid and myself and my family, where we really want to foster that goal of having a conversation and really being able to truly understand and listen to each other. Um, yeah, so maybe a little bit of my background just for some people who don't know me, and like what I'm about, if that is helpful in any way, because I know relayed that a little. I have worked primarily in the film industry for the last 8 years or so since I moved back to New Mexico. I am from Santa Fe. I grew up in northern New Mexico in the Espanola area. For those of you who attended the first meeting, I did give a brief introduction of myself. And, growing up in that area, there was not very much opportunity, at least that I could see for myself. And I still feel that there's still some of that. Growing up near Chimayo in that area was just, we heard a lot of stories about, being careful where you playground, a lot of the same kind of concerns that I'm seeing now here in Santa Fe. And those kinds of concerns are related to drug use and opioid use and a lot of trauma that has affected our region and our state, as especially Rio Riva is the highest overdose rate, I think, in the country. Stories about us constantly, in the media, and those things can wear on you just in the fact that it's true. But the thing is, what I found with learning about my own generational trauma. I'm from a Mexican immigrant family. My mom moved here when she was 7 from Mexico. My dad is Navajo, and just learning more about my indigeneity. I and fostering that through storytelling, really trying to understand where this is all coming from, and also being exposed to psilocybin therapy several years ago, um, for the first time, it really did shine a light on what, as an individual, but also as a community, a member of the community, and the place where I'm coming from, and my own family, and everything else, really just made me understand that this is something that can be moved forward, but it takes a collective effort. And when we talk about equity and access and cultural considerations in that context, where we come from, the burdens that we carry from our ancestors, and all of the trauma that they have endured that we're still holding on to, um, collectively as a community, that it can weigh that community down. And it's impossible sometimes to move forward. Even in my own family, I had what I call my baby cousin overdose from fentanyl a couple years ago. And it was his third time, and it was his last time. And, those types of things are not easy to process or go through or realize or admit to, that these things are so close to home that sometimes we don't want to talk about it or see that there's a problem. And sometimes we think that just by thinking it'll go away, it'll go away. And that's not the case. Sometimes we can't just think positively out of that pit. And that's why I feel that access to this medicine is so vitally important to our people, because it was something that was taken away from us years ago, whether through government overreach, saying that they know what's good for us, right? This is a little bit kind of ironic. But I feel that in the same way, that we can take that back. Just briefly, I was explaining that again, as a storyteller, I wrote an episode for Dark Winds, kind of specifically with that in mind. There's a Tony Hillerman version of Native American to spirituality. There's the Navajo spirituality and cultural teachings, and then there's the Native American church that was brought in to the people as far as religious practices. And I will say that a lot of my knowledge is a little limited. So that's why everyone else in the community comes in to bring in all of their knowledge together so we can look at it more thoroughly. But, that trying to study and understand where the use of peyote, which is not what we're discussing as far as psilocybin, but just as a background, coming in and saying that, we know what's better for the Navajo Nation. And of course, this also brings in this other idea of tribal governance and sovereignty, federal insight saying this is what we need to have done, and then taking it away, and then saying the Navajo Nation can do what they want, and then the Navajo Nation saying that they still want to do this, and now it's so several years of back and forth of saying, you can do this, you can't do this, you can go back. So I get it. I get that there's just so much. So I understand that we have a huge undertaking within this committee, and then also within making sure that we understand, at least in my mind, that there's a difference between ancestral and indigenous wisdom, which I feel was in some ways taken away from us as a governing body, as a governing citizens of the United States. But then also too, we have kept the ancestral and indigenous wisdom, which I feel is not necessarily should be something that's on my shoulders as an indigenous person, as a member of the Psilocybin Advisory Board, but that is something that should be distributed and shouldered amongst everybody, because we're from the state of New Mexico, because this medicine was here before the state became a state. But with that in mind, I feel that it's a part of all of our quote duty to understand and have respect for that, bringing it forward into, the people were here before the state was here, is my understanding. These are where my opinions come in. The people were here, the wisdom was here before the state became a state, but we have also an obligation to understanding that we are now citizens of that state. We have a responsibility to the rest of the community to help and understand and have that access so that we can move forward collectively as a whole, as a group, in this fashion. Now comes in federal and, tribal governance, 24 tribes here recognized, federally recognized in New Mexico. That's a huge, huge undertaking. And that's just looking at the Native American indigenous populations. That's not even looking at, what any other tribes that might be represented here but don't have a reservation, established reservation. And again, going back to where I'm coming from Espanola area, what is that equity? What does that access look like? And with respect to the populations that really need to be reached, and especially in the far corners of the state, people who may not necessarily be, what I want is that access to be available to the education, available to the outreach that goes into these communities. So again, it's about brainstorming and honoring and respecting all the hard work that everyone has already been doing on the ground, grassroots efforts, reaching out, calling tribal members. That work is insanely arduous, and I've had a little taste of that working for the Navajo Nation before. So anyways, I will get off my soapbox for a bit. I just kind of wanted to just throw at you, unfortunately, throwing at you um, all that I'm hoping. But I would love to start listening, where are we, to anybody who has who wants to speak. And I don't know how many people do we have on here?
So,
So,
Desba, we have 15 attendees at the
okay.
moment outside of yourself and the Department of Health staff that are here. Um, so, if you're ready, though, at any point, if anyone wants to raise their hand, we can unmute you. You'll still have to unmute it on your end, and we'll be more than happy to go ahead and start.
Yeah, I
We,
think, yeah,
yeah.
go ahead.
Oh, I was just going to say we have Matthew is the first to raise their hand.
Yeah.
So,
I think what
uh,
I'm going to do for now is maybe have people just so I mean, I do want to hear everybody, but I want to also get to everybody. I'm thinking maybe 5 minutes to get through to see if everybody, and then we can go back around again if anyone has any additional things to say.
okay, perfect. Okay, and Matthew, your mic has been enabled. You'll just need to go ahead and unmute. And to unmute, just so everybody knows, is if you're on the Teams on the computer or on the phone app, there's a small microphone next to the camera icon. Just click on that. And if you're on telephone only, just press *6 to mute or unmute. And Matthew, you can go ahead and unmute yourself. Okay, just to check in, Matthew, we can't hear you if you have unmuted. Um, we do occasionally have individuals who are not able to unmute. Sometimes simply dropping off the meeting and joining back in again works for that. So you may want to try that if you are not able to unmute your mic otherwise. The other item that or the other thing that we found sometimes is sometimes individuals have the wrong mic selected. If you want to try to select a different mic, next to the mic icon, there is a little down arrow, and you can choose which microphone is used there. And that, though, does depend on your own home system. Okay.
All right. Well, until someone else wants to raise their hand, I'll go ahead and, from what I know, and then please, Dominic or Jorge or anyone can jump in and re-verify it. But so again, we are looking for two more board memories. Sorry, board members. Um, and as far as I know, people who are not in New Mexico can participate in these committee meetings. We are going to be the chair people and the / board members will be uh, working towards making sure that any of the policies and regulations that we are suggesting and recommending are specifically for New Mexico citizens. But that, if there's any other input or observations that are coming from the outside of New Mexico, we're welcome to having other people join us and be on the call, because I think that this is, even though this is something that is in New Mexico, it is so vitally important for the people of the nation and anything else that they're doing. Um, Maybe that there is something else that's going on in a different state or in a different area that needs to be looked at or considered, that may or may not work with people here in New Mexico. And I think that so far as my understanding of what we're doing with that is important, in that, this isn't just, we have a responsibility, I feel, as citizens of this particular state to, um and what we're doing is that we're shouldering that burden in some ways for the future, and that may be the future of other states and what they're doing and what they're looking at. But it's also collectively where what we're doing here can take effect in other places. I often kind of look at it in terms of like the tiny Buddha in the corner of the room, that even though we're not, um, in that particular space, that what you do individually as a person, and then also within your community, and then also within the bigger part of the state and the community, can have greater effect and change around the world. And I'm not saying that necessarily in an ego sense of like New Mexico is so wonderful and great, even though we are, but it's just like, what can we actually do to help move this forward as a nation? And this is our time and our ability and our responsibility to do it for us and for others. And please,
And
everybody, if anyone else has to like their thoughts on what I said and want to have a discussion about anything I said, please, I also I encourage that. So
and Desba, we do have Kate, Kate, your microphone is ready, so go ahead and unmute and you may speak.
Hi, everybody. I'm Kate Hawk. I live in Santa Fe now, but I appreciate hearing where you're coming from. And I agree, we may be just little old New Mexico, but we are really in a position to be able to be leaders here and to have learned from some of the things that were done in other states, and deal with our own challenges and also our strengths. A little bit of introduction before I moved to Santa Fe. I lived in northern Arizona on and next to the Navajo Nation for 40 years. I was the director of the Native American Trauma Project going back to the 90s. Started the Star School, a Navajo charter school, which is still going there in our community. And so I worked a lot with Native Americans, mostly from the Navajo tribe, but some other tribes as well. Uh, you know, Geez, looking at Colorado as an example, I feel like New Mexico is doing some things right, at least in the language right up front. They acknowledged indigenous communities under, accessibility. Colorado, it seemed like, well, there was this legislation, it was voted on, and then, oh, let's have some indigenous people have some committee. And it was kind of an afterthought. Advisory committees, it feels like this advisory committee has some real power. Yes, we're just advisory, but there's genuine goodwill and wanting to learn and do the best for everybody. And in Colorado, it seems like, there was a 95-page report written up about, indigenous community or committee members. A lot of them weren't from Colorado. I'm not sure how many were from Colorado, but I know a lot of them were not from Colorado. And it seems like New Mexico has such more of a tribal presence, organized tribal communities. Um, it would be nice if there could be another committee member or two who are from Native communities or have connections there, which I don't. But I'm willing to participate here. I wanted to, at least get in on this first meeting and be happy to be an active member. So I just appreciate that we're all getting started here, and I'm happy to be part of the conversation.
Thank you,
And,
Kate.
and next we have Brett Phelps. Brett, you should be unmuted or just unmute yourself and you can begin.
All right. Thank you, guys. Yeah, and thanks for your help, Dominic. I've figured out for some reason my computer does not like unmuting, so I hopped to the phone real quick, so I didn't do that. What happened last time? Desba, nice to meet you. Thanks so much for leading this committee and all your commitment to this. So my name is Brett Phelps, and I am an attorney based out of Las Vegas, New Mexico, but I live in Mora, New Mexico. So I'm very much concerned with the issues in this committee, specifically about the access for rural, frontier, and underserved areas. And so just I don't know kind of what the committee's looking at as far as actually policy or rule recommendations or where where we're what the kind of process is for that. But I did want to just kind of put in some thoughts in terms of a couple of the points of responsibilities for this committee, specifically related to that. I think there's a couple things we can look at for access in rural areas. Number one is the telehealth. I think that's something that I see it mentioned here, so I know that's something we're already looking at. But as much as we can do on that is going to be, to the benefit of the people in these rural areas. I think it's probably very likely that a lot of the providers, the practitioners, are going to be based in Albuquerque, Santa Fe, Las Cruces. There may be some that end up in some of these smaller areas, but the more we can enable that. And another thing that I think would be really helpful, in terms of looking forward at policy recommendations. One thing that seemed to cause a lot of problems in Oregon was the location designations for where the therapy could be done, and it had to be in a dedicated facility for that. I think looking at regulations that, as long as there's security and safety measures in place, that the therapy can be done in other, in places that are used for other purposes that aren't solely for this psilocybin therapy. I know that's just something that has caused a lot of issues with the Oregon program, and I think that could help a lot. If we have places that are already doing other kinds of therapy and that kind of work that want to incorporate this, I think that makes a lot more sense than having to have standalone places in some of these smaller communities. Other last recommendation, and then I'll kind of turn it over, is on responsibility number 4 here. The recommended qualifications and process for determination for the Patient Equity Fund seems like a great place to start. There's anyone who's receiving any kind of state benefits. If you're getting any kind of food stamps, financial assistance, Medicaid, that seems like a great baseline for where to kind of look at that. Just as maybe we can go broader than that, but that seems like a very solid place to start. The other responsibilities I'm very much in support of. I like what you guys are doing, but I am far from an expert in that kind of field. So I'll be happy to, as things move along, to contribute my thoughts or anything I can do to help the program in any way going forward. But those are some of the specific things that I think could be really helpful, looking at the actual rules that end up being proposed by the board. And again, thanks to the Department of Health, all you guys that are here, and all the people taking their time to make this program work. And that's all I got for now. Thanks.
Thank you, Brett.
Thank you, Brett. And Brett, and for everybody else, just to acknowledge one aspect is we have looked a lot as far as what has occurred in both Oregon and what is happening in Colorado. And the issue with regard to locations was something that even when the bill was proposed and was brought up was very clear that it was not going to be something restricted to psilocybin only spaces, that really this is a tool to go into provider and practitioner toolboxes. And so that is not a restriction that is going to be occurring here, just so that everybody is aware of that. That's something from the very beginning that was being looked at to ensure that we did not have that barrier for individuals. So just want to
Love to
make sure
hear
that's
that.
out there. Yeah. Yeah, and it's come up a couple of times, but it bears repeating because we do know that people are hearing that as a big issue and barrier in Oregon, and it is something that from the very beginning was not going to be an aspect of the program here. So, yeah. Anyway, the next
Cool.
person up is Catherine Warnock. Catherine, you should be able to unmute your mic.
Hello, and thank you so much for everybody for your time and effort in this project. This is a very exciting time for New Mexico. I am a licensed professional counselor in Las Cruces, New Mexico, and I've been doing this work for a few years very successfully and helping people heal trauma, and obviously addressing the issues that are that this program was designed for. Um, I guess I guess a couple things I just want to say. I want to share a story that happened at a integration group that I was a part of. I hosted it with an Indigenous healer who we had people from around the state attending. It was an integration group around cannabis, psilocybin, and wachuma. And there was a very specific incident that happened that has really stuck with me, and I just wanted to share it with everybody. There was an individual in this group who spoke up about how important, cultural considerations are with respect to the treatment. And this person talked about how important it was to be able to have a ceremony outdoors in a group with a shaman facilitator, and how critical and important that was, and how they couldn't imagine being in an Airbnb with an eye mask, et cetera, that felt really like awful and something they would not consider. And then somebody else shared and said, I actually did it exactly that way. And it was exactly what I needed. And I can't imagine doing this outdoors with strangers in a, group setting. And I guess the reason I wanted to share this story, because it just stuck with me, is that we really need to be very careful about considering all the options. I think no one way of delivering this is going to work for everybody. And I think it's really important that we are really considering the cultural aspect. One of the things that really worries me about the way Oregon has been doing things is it's very structured, it's very rigid, it's usually in group settings with 30 to 50 people at one time, which means everyone has to listen to the same music, everyone has to have the same everything, right? And I think it's really important that when we're designing this program that we're looking at all the different ways, because like I said, I think what feels therapeutic and healing to one person isn't necessarily going to feel that same way to another person. And one of the things that I think is really, really important about the program that we establish is I think it needs to be catered to the individual. I don't think we can cater it to groups, meaning I think that like if one person needs a certain kind of music or a certain, with an eye mask or outdoors versus indoors, I think we need to have some flexibility in this program to allow for that cultural component, in that everybody is going to feel safe in different ways. Colonized white people, they want clinical, they want it to feel more sterile and more structured. But I know that that's not going to work for everybody. So I know I'm repeating myself at this point. I'm just really passionate about this point. The way I've been doing this work, I have been very much trying to cater to individuals, and I have found that has resulted in the best outcomes. So thank you very much for your time. I would very much like to help and participate. I was though thinking, and so please correct me if I'm wrong here, but I was thinking that the subcommittee members probably should be people of Indigenous, um, descent. I am a colonized white person. I have a lot of privilege. I recognize that. I'm an ally. So I'd like to help out in any way possible. However, I understand that maybe, there are other subcommittees that I might be more suited for, but I'm very interested in helping out in any way possible. So thank you very much.
Thank you, Catherine. Are there any other, looks like we don't have any other people raising their hands.
No, we do have one person who's on the phone.
Okay.
Matthew, is it the 9237 number, the number ending in 9237? Oh, yep, and it is. So go ahead and you can unmute yourself on the phone. To unmute on a phone, it is *6.
Hello.
Hi.
Hello.
Hi. So I tried to raise my hand earlier, and I was having some technical difficulties. This is Matthew Armstrong.
Great. Thank you, Martha. Matthew, we can hear you now.
Okay. So I'm a Lake Band Superior Chippewa. I'm living here in New Mexico, and just some observational points because I've watched all the meetings, and then just a couple things that I want to make note if opportunity is when we hear the word equity and access. I don't see much talk about Native African people and or indigenous Afrocentric. See, I feel like Black people would also benefit greatly from this due to the traumas and the PTSD of their communities. And so I just feel like we want to make this verbiage appropriate for everybody. And then, on another hand, while going through and studying for this, I've seen that there's an Iranian woman of a descent who's using the word indigenous because she's indigenous in her own country. So I feel like there's a lot of gray here, and that's just my take. And thank you for listening to me. I go by Anomish, which is my native name. If you need anything or any more points of view, I'm more than happy to help.
Thank you. Oh, sorry. Do you mind spelling that out if you're still able to unmute yourself?
Yeah, can you spell out what?
The name that you prefer to go by, your indigenous name?
Yes, ma'am. Anomish.
Mish.
It means big dog in Ojibwe.
Thank you. Miigwech.
Yes, ma'am.
Anybody else wanna chime in here? Ian?
Hi,
Yeah.
I can. Yeah, so I always imagine this committee, from like a healthcare background, we have this term called social determinants of health. And so that can include things like race, income, education level, other aspects that often commingle and can indicate that a group needs assistance because the society that they are in has failed to adequately support them. And so we have ended up with lower health outcomes in these populations. And especially when you think about the history that we took this medicine away from them, I always imagine this committee with strong Indigenous support and confirmation just from the fact that we stole a lot of their we re-educated them, took away their culture. We had a horrible things happen. And I recognize that. And so I think I agree with the quote that the US states are little laboratories of democracy because they show that when we give the people the choice and we elect the right people, we can kind of try to repair the damage that our ancestors have done. And so I appreciate all input from all groups. I wrote this to be broad because I think that a lot of issues that are experienced by groups are often caused by the systems that they are in. And so if we can build them correctly, then we can ensure that those problems don't arise here.
I definitely agree. And I am open to anyone kind of chiming in and having further discussion for the next year, but I'll get back on my soapbox a little bit just to kind of go through some of the points that people were making. And then especially I'll start off with yours. I appreciate you saying that that was part of the framework for why we were creating this with such a broad, equity, access, and cultural considerations. And to that point, that exactly what you said, that it's not necessarily so much sometimes, I mean, yes, we have a focus, right? We can have a focus with indigenous cultures and so forth. And I don't want to miss the importance of that specific thing. And forgive me for using improper terminology. You can totally call me on it and say, there's a better way of using a certain term. But going back to the fact that, I grew up in northern New Mexico, where both again to Ian's point and a little bit to Anomish, is that Anomish? His point was that, we're such a uh, isolated in some ways area, right? Both with the language and the cultural aspects, because the Spanish had come in and, found this indigenous people that were there. And a lot of that language is no longer a part of the current colloquial language is Spanish. It's ancient Spanish that people use. Um, that that a lot of what was taken away from indigenous people in the area is their own culture. And it was, I don't want to say replaced with, but it was colonized to the sense of like, you are no longer indigenous, you are Spanish, you are white for the sake of being a part of New Mexico, because New Mexico has its agenda to move forward and we're going to bypass that. That's not something that I want to be having happen again with this project, with our program. In the sake of moving forward with something, we're going to bypass once again indigenous and cultural considerations and that access, and we're just moving forward without consideration to you. I feel like that in itself has been a part of the trauma, which I go back to and say that it's not necessarily all on my shoulders as an indigenous person, that I ensure and I make sure, and I'm again retokenized to some degree, that it's up to me. It is all up to us as far as our responsibility to be here in this program and in part of the committee as we choose, as our time allows, and the rest of our responsibilities in the rest of our lives, to bring up the things that are important. Because in that sense, it's like, if we had the answers to everything, either as a group or as a whole, or as people in general, we wouldn't be in the place that we are right now. We wouldn't be having to understand and relearn, but that's part of the beauty of listening to other people and coming up, because there's something that we missed, or the agendas that we are trying to move forward. We're hoping, at least I'm hoping, that we can listen to everything and everyone as much as possible, so that we can go from a fractured state to a healed state, kind of similar to the Japanese way of, like, the creating the vessel again with all the cracks and stuff in it. Um, and so by listening to that, I'm here to listen, but it's also, I know I hear non-native saying, it's not my place to have to say something, or, and I get that, and I honor that you respect and are aware of who you are and what you bring, and your awareness in itself speaks volumes, because if you didn't already know, you wouldn't be saying that. in saying that, you know, your place in that way is the awareness and that respect to that, like maybe someone else should do it, right? But also to that point, um, you know, I also too am limited in my ability to be quote indigenous, as I'm also too relearning my cultural because it was also taken away from my family. And I've come back to my indigeneity through medicine that was provided from a non-native, you know, setting or area, you know. And I honor the fact because sometimes the truth and the message needs to be provided through that vessel. To me, it's the medicine, it's the message, it's the love and the care that's saying, regardless of the carrier and the messenger, I'm providing this message because it's important. And sometimes I feel that depending on the, you know, that person, that messenger's agenda might get in the way, right? But it is that person stepping back and saying, I am just a vessel and a messenger for this message and for the medicine to provide to you because it is that important. It is so important that we all need to hear it. And so in that way, I want to listen to all aspects because there might be something that I miss because maybe my training of how I'm in this world might be quote too white. Um, and by that, I mean, you know, I was talking to my dad some time ago about something else, and I said, you know, that's a very like non-Navajo way of thinking. And he's like, it is? And I was like, yeah, it is. And I had to help stop himself and to kind of reflect and become aware of the thing that he was saying. And so therefore I'm saying I'm offering this too to everyone else. I want to be able to listen. One of the things that I have come across in my own, and I've heard this from other people too, other Native people, and I apologize, I jump around a lot. And so, you know, you can call me on that. You can call me on anything. And she said, sometimes it's hard to gather and get all the natives together into, you know, agreeing. And I will say this is probably one of the harder aspects of working with another group, which is working on my Dark Winds show, was, you know, trying to come to consensus about how we put the story from the page to the screen, because everybody's right. Everybody has their opinion of like what exactly needs to be in there, and it's all conflicting. And to get on the same page, I know that that's very important, and that might seem in some ways trivial then to what the importance of this particular committee is doing, but I see that, you know, in other instances. And so that's why I'm saying, you know, it's good to be able to have different voices, and listening is so important. Having these discussions, whether or not it's like someone has a very strong opinion about one thing and then it's very opposite, polar opposite in another, I think is also important to listen to as to why, because maybe there's something that's being overlooked in pursuit of moving something forward. Um, but you know, back to you know, what Catherine was saying, yes, I think that's important, just to kind of say this, you know, that it's not anything that needs to be said is important. And then also there's, to me, a level of priority of what needs to be happening for this committee is like things that are urgent and you know, emergencies, very important. And also like maybe not so important but urgent, and then so forth. If anyone's familiar with the I think Franklin Covey, you know, quadrant square. And then there are some things that are, you know, meh, you know, we can kind of maybe not put that up higher. But for me, it's also a matter of figuring out what are the key components. Are there like 3 pillars? Is there 5 pillars that really need to be understood as far as what needs to be moved forward or important to outline, and a process of getting that onto the page and then again to the committee. So when it comes to, again, like what Ian was saying, as far as the equity and access of the different cultural considerations within that community, in that framework, um, I also hear what Brett was saying about, you know, places like Mora, you know, also very isolated. How does that look? that might be a place that's a setting for, a place that's a community gathering space outside, kind of to Catherine's point, where it's not something that's necessarily structured, but I feel like allowing um what that particular place needs, and what that, and then maybe, even though someone says, and I don't know what this looks like, but if we have someone who really needs to have more clinical setting, would they be able to then have access to that space where an outdoor setting is all that Modak is able to offer? But is there a place that's within that has one or the other? Is that something that we need to look at too, where people at least have two options in a specific rural area? What does that look like? Um, and of course, what I'm hearing from Dominic is that there's really not going to be such a rigid determination of like what that space looks like, because I feel like I know um, they're I'm not sure exactly which, my brain is not helping me right now, but they're looking at how to the set and setting of these trials, which is why they're asking for input from different specific groups, one-on-one interviews with women who have faced trauma, um, um, first responders, and Army vets who have experienced PTSD. I think that they already have enough input from that particular group for these clinical trials and what those look like, because that set and setting is really important. And then also, especially the integration portion. How are we having services established? I know that it's a completely different um, project, but the wraparound services for juvenile offenders. I'm familiar with that one from, they were trying to implement it in northern New Mexico. I think it works in Santa Fe. But how do we have community involvement where we're allowing the community to heal itself, as opposed to just throwing the kids away in 3-hour away detention centers that, are not a part of their community? How can the community really come and help itself take on that responsibility and accountability for, yes, this is a part of our problem, and these are our brothers and sisters, these are our family members, regardless if it's through blood, it's through community and networking ties. But yes, so that's my soapbox. I don't know if anyone else had any other things that they wanted to chime in. I think I see
Yes, Bob.
James. Yes.
Yes, and James, you can unmute yourself and go ahead and speak.
Hello, everybody. My name is James, and I'm from Arizona. And I've had the honor of working in the addiction medicine realm. And we worked closely with Native Americans ranging from the Gila River Indian community, the Yavapai Apache Nation, Okchin, and as well as the White Mountain Apache tribe. And through these experiences that I've had, a lot of people were impacted by severe alcohol use disorders and methamphetamine. It's rampant in the reservations, and I personally witnessed how the stigma, the geographic isolation, and the limited resources can really compound. And it is absolutely terrible, the stories that I've heard. And I really praise and honor this community to really carefully and respectfully give praise and actually help people that really need it the most. I really liked how you had mentioned, Desba, the Japanese saying of wabi sabi. It's looking at the beauty of imperfection and how can we look at such an imperfect system and try to make it beautiful again. And I really respect that. One of the things that I really would love to hear thoughts and opinions about, and kind of echoing what Brett had to say earlier, is location. Travel and transportation is very difficult for many people. And if we have designated areas that are very far from somebody, then that means that we're limiting access to people that might need it the most. And so I'm all open ears, but trying to make this as accessible as possible with varying locations, and working with local tribes and their public health um, areas would definitely be something that I'd be for. So thank you for giving me the time to speak, and I really applaud everybody for being here. This is very important.
Thank you, James. Yeah.
I don't see any other hands up. Is there anyone else who would like to speak? And again, to raise your hand, you just need to click on the little hand icon near the top of the Teams window if you are on a computer. If you are on a phone, it is press *5 to raise your hand.
And maybe I'm not sure to the extent of like what this committee, this time and this space for this meeting is, Dominic, but you know, it seems that at least from what I'm hearing from both James and from Brett in that space, Brett was mentioning something about telehealth. And, you know, to me, it seems like this is the place in where we would figure out what would be the best recommendation for kind of figuring these things out. Because when I hear telehealth and I'm hearing set and setting and I'm hearing isolation, geographic isolation, and then also when I'm thinking about, and this might also reach into other committees as well, is, you know, the facilitation of these things. Where that committee and our committee can cross over is how we provide a recommendation to the administrator or facilitator for these particular things. Like, what does that look like? And is that a matter of providing or finding funding for a traveling facilitator, someone that is able to work with an individual in that particular space, especially depending on order of magnitude of their uh, need. You know, and that goes more into where in I'm thinking is the dosage and the setting, et cetera. Is that kind of where I feel like there's crossover, more room for talk as board members, and or trying to figure out how we're making sure that we provide a safety net for this program?
Right. So, Disba, that's actually a great point. And telehealth has been something, again, that has actually been being looked at since the beginning of the program. And just to give an idea, for example, with the current medical cannabis program, the evaluations that providers are doing with their patients, those can often be done through telehealth. And so we do envision that there'll be that aspect as well. What all of the details for that will be for those evaluations, we'll see. With recommendations with regard to telehealth during actual journeys, that is probably going to look very different and need to have individuals there. I do see Catherine's raised her hand again. So, Catherine, I'll just say a little bit more and then I'll defer to you a little bit here. But as far as from an equity and an access standpoint, it does need to be looked at as far as how do we get that access in those rural communities and ensure that it's there. As far as the equity fund, that again, that will be determining what are the requirements for how that funding should be dispersed and how that funding, you know, who will be eligible for it, what considerations there are that can include a wide variety of things, not just you know, for example, income, so socioeconomic status, but also could also include geography and some aspects with that. For example, how far do people have to travel? Is there some sort of reimbursement needed for travel expenses, for being able to, for patients to be able to stay, you know, with housing, you know, temporary housing and hotels, that sort of thing, when they are traveling for their treatments. Those are different things that this committee can be looking at and helping with regard to the recommendations. In addition, there is going to definitely be overlap with several of the other committees, and definitely anticipate that to occur. And one thing that did come up in the other committee meeting this morning is one of the things the department will do as part of our administrative support is when there are those kinds of questions or recommendations to other committees, we will ensure that they get on over to the chair of that committee so that they can be raised and brought up during their committee meetings as well, so that there can be that cross-pollination, which, by the way, does not mean that people from one committee cannot either attend or serve on another committee. In fact, we do encourage it. That kind of cross-pollination is actually, I think, going to be very important as to the way things move forward. With that, shall I move on to Catherine? Okay, Catherine, go ahead. You should be able to unmute.
Thank you, Dominic. And actually, you spoke to it after I'd already raised my hand, but I will go ahead and elaborate. Based on the work I've been doing for about 3 years now, being that I am in Las Cruces, I do end up using telehealth quite a bit for the preparation, for the integration afterwards. And I do agree, Dominic, that during the journey, it would not be appropriate to just use telehealth. I think we can incorporate telehealth, meaning if there is a person that can be present and maybe then online in addition, that's an option. I think that would be definitely something we'd need to like work some of the kinks out a bit. But I can just say that the prep work and integration has been very successful using telehealth. In addition, I have a meeting the day before a journey at the location with the client in order for them to establish set and setting the day before. So there's nothing new on the day of. So I would say though that for if other people decide to implement that same structure, which I don't know if that's going to happen or not, but I will tell you it makes a huge difference in allowing their anxiety to be relieved the night before. I do think those both will need to be in person. I don't think there's a way to get around that. I think that there's a lot more details I can talk about later, but this is an area where I feel like I can really contribute and participate. So thank you.
Thank you,
Yes.
Catherine.
Yeah, go ahead, Dominic.
Oh, I was just going to say, and Matthew had put into the chat, and I just want to make sure that for those who aren't able to see the chat very well, if they're on phones or other items, he wanted to add that equity should be considered from a patient and facilitator, with the facilitator aspect meaning not just who and how treatment is equitable, but how do we make sure that it's applied to the people who heal within their communities and have experience but not a medical background. So
Yes,
just wanted to make sure that was there.
Yes, thank you. That's another good point too. And I think that's also might be overlap into training as well, maybe perhaps because that is how do we take care of the healer, how do the healers take care of themselves, right? How does that, what does that look like when it comes to trainings as well as certifications? Who's going to be able to be the facilitator and or administrator in these particular ways? So that might be of an interest if you go to the different committee links that are going to be available. I think training is also one of them. I think it's the last one so far before we have our board meeting. But I'll go back to Catherine's point in just a second. But to that, the accessibility to us, I think so far at the end, we can have a space where, if there are things that people wanted to email the group about with regard to each of the committee meetings, we could probably have that in there where it's the subject line is the committee meeting, what date of the meeting it was, et cetera. And just so that we have that kind of collective, and then we can all be able to look at what the notes are, the questions are, and have that for reference when we have our board meetings. That's the way that people can access the group is through the psilocybin, I think, email that will be provided at the end. But then also just being able to sign up for the email news blasts that we have about future board meetings that we will have. But yes, to Catherine's point, yes, exactly. This is the whole point of it. There are people who are doing the groundwork, as Kate had mentioned before. She did extensive work in Arizona with the Navajo Nation before, and you see things. And even though it's as an outside perspective, but it's also within the perspective. My ex-husband is is non-native. He lives out on the reservation. He's a school teacher. And he has a different perspective than I do. He's in the thick thick of it. He sees and he knows that he's got ears of what's going on. And whether or not like he has a non-native perspective, he's there. He is he's witnessing what's going on, and that's not for nothing. But then also too, we have, and I want to make sure that we do emphasize that we have other cultural considerations, such as what I'm sorry, I'm going to pronounce your name wrong. I'm going to try not to. Let's see. Did I have it in here? Anomish was saying about, you know, Afro-Indigenous. That has also been another neglected aspect, you know, of Indigenous culture on the whole. What does that look like? I had my first encounter with Afro-Indigenous cultures out in Massachusetts, you know, the Wampanoag. Um, and it was just so interesting to me. But that is again a result of, you know, intermingling, assimilations and cross-cultural um, teachings that we can all share. And oftentimes we see that some teaching that we have in a different culture, there's a mirror somewhere else in a different culture that we might have neglected. And it all does come from an indigenous place. At some point, we have all been indigenous in our ancestors at some point, whether we're here now, whether we stayed close to the land. But I feel like returning to the land through the medicine, through the work of figuring that out, is part of the healing of returning to our ancestors. And that's where the medicine is all bringing us together for that purpose. Um, let's see, I think we have someone else's hand up.
Yes, next is Brenda Burgard. Brenda, you should be able to unmute yourself.
Hello, everyone. I'm Brenda Burgard. Thank you, Desba and Dominic, for having this meeting. This is really super important, I think. A little background about myself. I am on the advisory board for teaching and training. And I just wanted to add a little bit here. I'm primarily a telehealth therapist. And I found that what Catherine was saying earlier is dead on. Just having that training about telehealth and psychedelics is really important to reach out to the community. And I was thinking there could maybe be a possibility doing primarily telehealth with a patient like somewhere in New Mexico, and then maybe the therapists themselves could travel to the individual, because I deal primarily with a lot of people who are homebound because of physical disabilities, or again, that transportation issue is a big one, because that's why I provide telehealth, because many people don't have access to a bus system or a car or even a relative to drive them somewhere, and then the expense of a hotel or possibly having accommodations for people. So I think that's going to be a really big one. And not to say people would want to have a ceremonial type of therapy, or uh, maybe a hybrid of a little bit of both. But like you were saying, Dominic, this is going to be a real mix and hybrid of different things for different individuals. And I think we are doing a service to meeting people where they're at. So thank you very much.
Thank you, Brenda. And then also to that point, you know, I'm hearing this kind of coming up with the telehealth and the geographic isolation, but also societal, not necessarily geographic isolation, but the transportation issue. And this, I feel like if some of you who are on the call haven't already known each other and know who you are, this, I think, is a great time to make sure to reach out so that these are networks. If you have, I mean, New Mexico is such a broad area. And I know that another friend, I wish that they were on the call today. But it's just, what does that look like when you're reaching out to the groups? And maybe Kate can also talk to a little bit about this if she chooses to, if she's still on here. But I know that was years ago. Is while it's been brought up to me about making sure that we understand Indigenous aspect of this committee and or just in general, there is the aspect of federal government, tribal sovereignty, federal treaties, and their responsibilities for the tribes. That brings up an issue of tribal governance, and that's where I definitely not quite sure what that actually really looks like. But I do know that as far as like grassroots individual programs within a nation, that might be the place, which goes back again to the networking, which goes back to knowing who is out there for recommendations. As a therapist, massage therapist, it's important to know what other people's work is like so that when you can't take care of somebody, you know who else to send them to that can be able to provide the service that they need. Or you're not a rolfer, or you're not like a myofascial release person. You know the people within your network who you can send and recommend them to. Or you know the benefits of a chiropractor or any other kind of physical therapist. You know the other therapists and the work that they do, so that you can make sure that, again, there is that safety net. And where our travel and our outreach might be really important. And I'm not saying that anybody is, I'm just, throwing this out there that, by keeping ourselves precious to the work that we do and not knowing who else is out in our field and what kind of work that they do. Maybe someone is brilliant at clinical settings and making someone feel really comfortable with their first journeys or, with this particular thing. Someone else might be really amazing at doing one-on-one individual work, and might be someone else who can handle a group of 50 people, even though that might not be like the most beneficial setting. But I think that, understanding where those people are by networking, by having these conversations, by knowing, and then also too, bringing this out more to light. So we have these conversations with our families, if we haven't already, over our meals about the work that we're doing and why this is important. I feel like that's another aspect of this as well, is, being able to have those conversations out in the open more so, rather than that we can be a little more open about it. This is something that's really important for our health. If you don't destigmatize something, then it can't be a part of our everyday occurrence, because again, it was so considered taboo. A completely different analogy, women's health, menstruation, that sort of thing. We don't talk openly enough about this very normal instance of our own bodies and what they're going through. We're too ashamed to talk about these things. And why is it a shame to talk about our traumas, our griefs, our process, the things that we're trying to go through in our life, and the things that we need to do, and the lengths, medicines that we go for help. But we need to have these more as a conversation, in our everyday life. And I know that I haven't necessarily experienced that so much. It's mostly with the people that I know. But, we're finding that education and that outreach could just be one-on-one, but it also is in our networking and knowing who are our allies and who is good at certain individual things when it comes to our health. Let me see, just read the was that I think we can all agree PrEP can be telehealth. Yeah. The requirements for education licensure will need to be determined. Yes, so there's still a lot of instances, and those are really good points to bring up as far as like what each of these things looks like. So when we're finding out what those requirements are for our trainings, I think that there's several, I was trying to participate in a training before, but for Colorado, and they do have certain requirements, funding, even to renew my own license as a massage therapist. And I know that that's completely different for everyone else in their own respective professions. How much the cost is to get started, and then also what does that look like. But then again, those considerations of that it should make sure, I think part of it is just making sure that on the side of equity and access and cultural considerations, that the recommendation from here that moves into the overlap of other trainings and so forth is what that actually possibly looks like as far as making sure that it is cost effective, efficient, not overburdening with on both sides to the provider and the patient. How does that look like? But making sure that it is congruent between the two. Um, but yes, telehealth, it seems like that is something that it's cross-referencing to both. All
And
right.
Despa,
Yes.
Kate has their hand up.
Yep.
So Kate, you should be able to unmute yourself. Okay. Kate, it does seem
Yes.
that, there we go. Okay, go
Hi
on ahead,
there.
Kate.
Yeah, sorry, I accidentally turned my audio off in the process of trying to get on technology. Yeah, just building on what you were saying about you know, relevant to Colorado, I did my Colorado natural medicine facilitator training. And part of it was just to understand the system and to be prepared for what we're doing here. But when I went through the training, and then I don't think I'm going to complete, all of the supervision and everything to be a Colorado facilitator, because it would require going to the licensed places, which can cost $500 a day or more for a setting that might not be the setting I really want to work in, and also accessing the mushrooms, which are hundreds of dollars a dose. And some people have said they weren't really the quality that, even though they're through the system, but they weren't the best quality. So as we go ahead, thinking about especially communities that have limited resources, I'm really happy to hear today that this, from the beginning, New Mexico has looked at, not requiring all the same restrictions that Colorado has, and especially in Native communities, just thinking about, well, what are appropriate settings then? Is it going to be anywhere and just up to the facilitators? Or are there going to be some kind of qualifying conditions or at least recommendations for those settings? Just wanted to comment on that. Thank you.
Thank you, Kate. And just so that everybody knows, I actually just pulled this on up because since there is a lot of questions regarding telehealth, and I'm putting it on into the chat. But essentially, there already are protocols as far as and what is actually considered appropriate with regard to telemedicine and telehealth. And so I'm actually going to share the document that Medicaid has, and with one exception on it, as far as the provider residing outside of New Mexico, I think that this actually fits in very well. And so the thing to remember is we don't necessarily have to reinvent the wheel when we're looking at a lot of this. A lot of this is already in place. We just need to make sure that as it moves forward, that it is going to be equitable and accessible for individuals. And so should be able to go to that link, and that shows again, this was through Turquoise Care, through the Healthcare Authority, that actually published this earlier this year. And it actually shows what the requirements are for telemedicine, prioritizing some options, and then, of course, for Turquoise Care in and of itself, how they help to promote telemedicine. But, and again, the only thing in here that may be a little bit problematic with regard to the Psilocybin Act itself is the provider residing outside of New Mexico. But again, that's a determination to be made in the regulations. Anyway, it looks like Ian, I think you are next on with your hand up.
Yeah, I just wanted to let you know. So if you want, you can make a recommendation to like another committee so we could vote to say um that PrEP can be available by telehealth. And then you can make that recommendation to them. They'll take it, turn it into patient safety approved language, and then that will get sent to the board if you would prefer to do it that way.
Are you speaking to me and or to everyone else as well?
Yeah, so I'm speaking to you as chair because you would transmit the vote on what we were doing. So if we were saying telehealth should PrEP can be acceptable, and then we as the like patient safety and qualification committee would go and say, okay, we got this from them. Let's make sure it also aligns with our or crosses with our domain, and that way it's checked off by both.
Okay.
Or if you leave it more vague, then the specialization can be done by the patient safety, because that would fall, or I mean, training and education, because that would fall under their jurisdiction and so forth.
Yeah. Yeah. And then so what I'm hearing from Dominic is that essentially from this document that you provided that everyone has access to within the chat, the New Mexico Medicaid telemedicine, that the language from this essentially, but without the outside, just that last part. So it says telemedicine service requirements, and then there's 4 bullet points. And it says if provider resides outside of New Mexico must be licensed in New Mexico. So that one essentially, for example, struck out, and essentially like this whole document itself could be a basis for that telemedicine consideration.
Yeah, I'm just putting it up on the shared screen for people to be able to see. And that is correct, Desba. And so it's not necessary that an entire new telehealth policy be written. It's already actually a part of the normal regular procedures for behavioral health medical care. And again, the only thing with regard to it is just again based upon what is being determined as we move through the regulations is the provider being in New Mexico might be the only restriction or additional restriction that might be needed with regard to this. And that's again where we say is a lot of times we don't necessarily need to reinvent the wheel because it's already here. The process is already here. The question just comes down to, will the services be allowed to be delivered through telehealth, and exactly which services it will be. But the actual mechanisms around telehealth don't need to be determined. And it looks like Brett has his hand up. So Brett, if you would like, you can unmute yourself.
Yeah, thank you, Dominic. Sure, I'm glad. Yeah, glad we're having such a good conversation on the telehealth side. And I may be, somewhat of an outlier here based on what I'm hearing from other folks. But I do think it's worth considering that there may be circumstances where the entire process could be handled through telehealth, at the discretion of the provider. Obviously, that's not going to work for everyone. But I think it's something that is worth considering, and specifically looking at these, Medicaid requirements or service requirements. The one that's bolded in the telemedicine service requirements is no restrictions on services that can be offered via telehealth. So if we're, translating that into this program, I think it is something that, you know, could, yeah, and you obviously got to put proper safeguards in place, but I don't know that it needs to, you know, automatically be ruled out from the jump, or unless, you know, unless there's yeah, strong reasons for it that y'all have said. But I think it's worth considering that in certain circumstances, you know, it may be appropriate for um yeah, for the entire process to be done through telehealth. Again, I do think that would increase the equity. But obviously, like I said, I know I'm an outlier on that, but I just wanted to throw that out there while we're having this discussion. So thanks.
Thank you, Brett. And I think that's a good point that you bring up, and in the sense that that's a good point. I think for this particular session, since it is the first one, and I do want to get input more also from the um, Wednesday night meeting from other people, but I'll bring this into that session. Is that okay? This is a good kind of like starting point that we can kind of start having a conversation, which is what I'm hoping for. Is like, okay, this is what we are recommending, and this is what we're point to consider, and this is a good place. Like as an example, because that good point, no restrictions on services can be offered through telehealth. And this is where I would, you know, argue along with anyone else too that you're right. I think that the telehealth portions, as Catherine had suggested in the beginning, evaluation. What does the evaluation portion particularly look like? And then this is something that I guess would go into cross-pollinating with the board. What does those evaluations look like? What does that look like as far as equity? But as a starting point, let's look at telemedicine, New Mexico Medicaid, and the language that's there, and adopt, 99% of it, with the exception of these two lines. Those ones need to be looked at further, and we need to figure out what would either replace it and or augment it in some ways. But yeah, the restrictions on that, for instance, for the sake of conversation, that would be definitely like a point of conversation through the journey section of that, regarding equity and access, but also taking into consideration the importance of, quote, ancestral and indigenous wisdom, where this is that might be something that a facilitator might, in regards to regulations in medicine, how far does the government step in, right, to say what is acceptable and not. And again, this is just for the sake of conversation and argument, is, there might be some people who can handle a journey on their own. And I'm not to say who those people are, but maybe that is something for a later conversation with the evaluation of the person. But I also don't want to be on the side, I want to err on the side of caution, where it would be better that before that happens, that, say, like the release of the one-on-one patient therapist model or facilitator administrator model, is that at least closes out. I don't know what that looks like. Again, this is probably a cross-pollination, trainings, facilitator conversation. But it is a good place to kind of look at. This is when we start getting into the weeds of the language of what really is something that, what is the care of our community? And especially for me, and I'm thinking about these isolated areas, I would want to rather err on the side of caution, especially when it comes to the care of our communities. And I feel like that one-on-one facilitator administering journey setting is invaluable and in some ways necessary. So that's just kind of putting a pin in it. That's the kind of conversation that we can definitely have. That's where I feel like, really fine tuning what these look like, putting a giant pin in this as far as something to go back to and make sure that we have straightened out and before, December 30th, 2026, we've had a chance to really look at it and evaluate what that really looks like when it comes to adopting policies that are already, provided, and what that looks like. I think someone else might have had something to say, or Catherine.
Yeah, I just wanted to say that I think Dominic kind of addressed it a little bit in the chat where, you know, there's certain things you can't do on telehealth. I mean, you can't do surgery on telehealth. There's certain limitations, right? And I think, like, as a practitioner, I would not be comfortable doing it on telehealth. I wouldn't do it. So, um, I just feel like the whole definition of the way therapeutic use of the medicine is, it requires providing like safety and being present to be able to address their needs, help them to the restroom. There's things that need to be done. And so I get that this is probably a conversation for later, but I just can't let that comment go without at least weighing in back on the side. Like, I've been doing this for 3 years. I would never ever be comfortable doing this via telehealth. There's other psychedelics that I would be comfortable doing. MDMA is one of them, but definitely not psilocybin, and especially not for somebody who, doesn't have any experience with the medication. I think that people can do this medication on their own. I call that recreational use, and it can be done in a therapeutic way, but it's not psilocybin assisted therapy. So I just think that I think it would be very dangerous for us, for safety standpoint, to not have somebody present to keep the people safe. One of the big stigmas that I've been having to work with since I've been doing this work is people are terrified. Am I going to jump out of a window, and am I going to run out into traffic? Like, these are things that I hear all the time. And if you don't have somebody there with them, there's just some things that I think we're just going to have to, um, look at from a safety point of view. So that's my 2 cents. Thanks for listening. Appreciate everybody.
Yep. Thank you, Catherine. And I think you're definitely not alone in those concerns. And that's, again, for the sake of conversation, just kind of pointing that out. Because this is a good time. What I'm hoping for also too with these committees is, it's not, I love you all, you're all amazing. I really want to also broaden it to the general public. I really want it to be people who are curious and be like, oh, what's New Mexico doing? Why do they think that's so important? I think that's bogus, or whatever it is. I want these people in the conversation, to even just listen in and hear what we're having to talk about, because there's so much, and this is just one committee. I want people to kind of come in and see and understand, like, why is that so important? Why is that a concern? Why is that, why are they having this discussion? And really seeing the importance of why we're trying to carefully look through this. And so, I know that, we're only specifically talking about psilocybin and therapeutic use, medical setting, et cetera. I think I just briefly saw someone say something in the chat here. Let me check it. And people use this medicine in therapeutic countries. It is not recreational just because a therapist isn't there. Well, this is true. And again, this is all a really good conversation. The comment was, it's just because someone's using it by themselves, it's not recreational, it's also therapeutic. And I do agree on that. Again, opinions aside, and et cetera, these are all good times to have a conversation. I know, I can't remember which, I think it's ayahuasca. I'm not sure which one it is, but anyways, outside of this committee, or no, I think it's, maybe it is mushrooms. I can't remember. One of them, 13 years old. It's a rite of passage when the children go into, to become a functioning member of their society. 13 years old. My kid is 13. I'm like, that's not something that I feel like, that's not the culture that I was raised in. That's not how I feel comfortable. If I was a part of that culture, it would be something that would be a part of of my teaching, right? This is not what we're doing here. Every other place has their own understanding. And so that's where we all have to kind of get onto the same page as far as like what is the therapeutic medical settings or use, and how is the government actually going to provide that space and that structure and that framework. There might be things that fall outside of that. And I don't want to say we're not going to talk about that, but it is, we can't sometimes pull some of those things into. But to that point, again, back to this is where it is a little bit, I don't want to say difficult, let's just say a challenge, where the ancestral indigenous wisdom comes from, right? It's not always necessarily recreational if, say, someone outside is microdosing, or what does that even look like? What is this threshold? What is that, is the microdosing based on the therapist, the facilitator, administrator, the person? Someone could probably see that like a gram is a microdose. Other people are like sensitive to 0.3 of a gram. Again, back to dosaging, what that's going to look like, how that's going to be regulated, what are those systems going to be in place. But back to Catherine's point, yes, some of these, everybody handles things differently. And we have to make sure that we are allowing to have a safe space, that this is a safe space, and that there are a certain amount of regulations when it comes to it. And administering, facilitating someone's journey, especially if it's going to be, and I'm assuming a lot of this is going to be for the first time, because this is going to be the first time that someone has an opportunity to sit with the medicine. And there are a lot of questions. I had a lot of questions, and honestly some of them didn't get answered right away. And but for some people, they're going to need to research absolutely thoroughly, beyond, this could take years of them researching. It could take years of them feeling safe enough and feeling comfortable enough. It takes the right facilitator, the right place. They might be limited to the options that they have. Brett might be the only person that they have an option to hang out with. But maybe if it calls for it, maybe Brett might be able to bring in somebody. Maybe there might be someone else that could be able to facilitate. Maybe someone is a traveling therapist. I don't know what these things are going to look like, but I think it's important to realize that there is a lot of time for conversation, but we also need to make sure to remember like what are the metrics that we need to hit as far as, is it safe, a safe environment? Is the person going to feel, are we having enough frameworks that they're going to be able to have what they need, right? Their environment. I come from a Montessori background training where you don't control the child, you control the environment. You provide a safe space for them to be able to allow for their journey through the space. And I feel like that's kind of similar to what we're hoping to be able to create with the regulations in some way. What is that environment and that framework going to look like so that the person has a personal relationship with the medicine, that they feel that they are safe enough to move through it? And also that in some ways, the access was taken away from that was taken away from us, from all of us, really. Something that was provided for thousands of years. And since mushrooms and fungi have been with us even longer, they're older than us. They're older than humanity. They're older than a lot of the living creatures that are here. That is millions and billions of years of knowledge that is being able to be provided to us, that because of our own fear of what that knowledge is, we decided to put a stop on it. And now we have an opportunity to lift that stopper and to honor that actual ancient wisdom that has been held since the beginning of time, right? So in some ways, we have to carefully undo our own undoing And that's where I feel like this is an opportunity that we have here to do that. If we come together and have these conversations, what are our fears? What are our concerns? So that we can um, move us all collectively towards healing. Another soapbox, sorry. All right, in. Did you have something to
So I
say?
just
Oh, yeah.
wanted to say that from my current understanding, we have to create the standards for licensure for approved settings. So someone's home wouldn't be able to necessarily go through that licensure process. The only real exception is probably going to be hospice care for the time being. Telehealth for preparation sessions, on the other hand, um, that I think is still universally agreed on. We would have to have a vote on it, but yeah, if we can prepare a document for that, that would, and then vote on it, that would probably be widely supported. But let's see what happens in the other meeting.
Yeah, no, I agree. I think that as far as I'm concerned, this is a good starting point about, this is what was talked about the first meeting, go to the second meeting, and at least have this proposed, hey, this is the document that we're hoping to start from. For the sake of purposes, please don't kill the messenger. Copy pasting what we can from this, and then being, uh, New Mexico psilocybin advisory, telemedicine, et cetera, or something to that effect, but with these pieces stricken out. And then also having people have a chance to look at that for sure. And then kind of moving it forward as a starting place, right? We need to kind of keep things progressing. And it doesn't mean that there isn't going to be room for more discussion or, hey, wait, I looked at the document again. This is kind of something that was concerning to me. Not to say that that isn't possible or that, but this is just a place to start. This is what we're going to look at. We can start putting the pieces of our house together so that we can actually have a place to live by the end of the year would be kind of nice. And yeah, so I think to your point, in as far as like the settings for the journeys, I think what I heard you say, Dominic, earlier though was something when you were talking to uh Brett, was the designated areas don't Brett was concerned about a more flexible designated area that was different from Oregon. And that
So
sounds a little contradictory to what In is saying, but I'm not sure where
no,
that actually is different.
no. So the issue in Oregon is that the locations have to be only psilocybin, so they can't utilize them for other purposes, and that's Oregon has had, and they're actually trying to change that, and definitely kudos to them for trying to change it. But what that has meant is it's meant that a lot of clinics and areas could not be offering other services in those same spaces, and so it really restricted them. And what we're saying is, for example, and Catherine, I'm just going to use you since you're here. If Catherine, for example, is doing other types of therapy in that space, whether it be MDMA, or any other type of therapy, it still can also be utilized then for psilocybin, whereas that is not the case currently in Oregon. Again, hopefully that will change. But and that's where that flexibility comes in. But as a reminder, this program, as the statute is set up, is it is a medical program. And so there does have to be that sort of that medical supervision for the medical services aspects of it. And so that's something to remember, to keep in mind. What exactly that medical supervision requires as far as like licensure, that's a part of what still needs to be determined.
And then also to that point, I know that maybe this is getting a little bit, well, it's not, let's just say this is cultural considerations and it still works. But to your point, in as far as like the hospice setting and not in a house, someone else's house, um, opinion on whether or not it should be in someone's house aside, um, But to Catherine's point about, where would the setting be if someone wanted it to be outside, so forth. Now, putting a pin in both of those things. From my understanding, what Larry and Janice and them are doing as far as creating the clinical trials and figuring out what would be the best way to conduct the trials is that, and that's also somewhat different because I'm hearing that's trials and not actually establishing facilitation of it after the fact. Outdoor use in the woods. That's what I hear a lot of people wanting to do. So that is in some ways contradictory to what we have proposed now as far as like hospice settings, or is there room for us to be able to have, both? Or is that's the whole purpose of like, we need to have that flexibility of if the outdoor setting is attached to a specific facility. Does that make sense, or am I completely like going all over the place?
No, it makes sense, Desba. Part of what it is some of those requirements need to be determined. And it was brought up in the chat. I'm not sure who said it a little earlier, but safety concerns and considerations. For example, you're not going to want to do this in a setting where somebody could potentially wander off and hurt themselves simply by falling into an arroyo or something else. And so when we're talking about approved settings, some of those requirements need to be set up, but it's going to need to ensure the safety of practitioners, participants, patients, everybody who's involved in being able to do that. Are there some potential pathways? Perhaps. But one of the things that we have actually had, and the idea that Ian has brought up, is something that we had considered from a programmatic standpoint with regard to hospice in specific, because you can't expect somebody who is in hospice to then travel 10 miles or even a mile down the road. So we do need to figure some of those aspects out. And part of that is going to also be what will be acceptable legally, and sometimes we're going to have to make compromises. But these are good questions. These are good things to be considering. It's exactly what we need to be discussing and talking about. The thing to remember is within the strictures of the statute, because there are a lot of people who have brought up other aspects in other conversations and meetings that just are not within the realm of the statute. For example, decriminalization. This is not a statute about decriminalization. It is about medical use. We have to focus on that aspect. And that's not about anybody's in particular personal thoughts or beliefs. It's just we have a particular set of instructions that are outlined within the statute, and we have to follow those. And then because there's not a lot of time left in the meeting, and I do have somebody did make a comment about would insurance requirements have an impact on the discussion. So just with regard to that, is insurance may always have their own requirements, and they may be different or more strict than what is allowed by the program. It doesn't mean the program wouldn't necessarily allow it, but it may mean that some individuals, in order to get reimbursement, or providers, in order to get reimbursement through insurance or even Medicaid, may have to meet more strict requirements. So that is a different aspect of it, but it's a great question. And so that's something to remember as well. From a program standpoint, we may have a lot of flexibility within the regulations, but insurance may require some other, may have other more strict requirements. And they do that in other therapies and other medical procedures as well. So that's something to remember. But Brenda had her hand up, and I just want to make sure that we don't miss out on Brenda being able to speak. And I only say that because we have 10 minutes left in the meeting. So if that's okay, I'm gonna shut up now and let Brenda go. Go ahead,
Okay.
Brenda. You should be unmuted.
One really quick point. It's just very quick. The reason for telehealth and is because it fails. You could be in the middle of something with someone and it completely goes out, and that's why it should be done in person, the primary treatment or healing process, because I can tell you that I'd have to call somebody on the phone, and sometimes their phone is out or it's not charged. So there's a lot of technical difficulties that happen with telehealth. So doing the preliminary counseling, um, but during the psilocybin session, yes, all must be present.
Thank you, Brenda. I think just for the sake, not that this is official, but just for the sake of understanding, can anyone raise if you can use the emoji raise hand? I just wanted to get a vote of how many people are, it's a two-part. With the idea of like telehealth, that this is, evaluations are good, journeys, not so much. But at least understanding that the kind of to what Catherine was saying, evaluations, integration, that's how she's using it as the telehealth as like a sandwiching, that the journey itself needs to be one-on-one. And that's like the only thing. We can have conversations, it's for another time, but does anybody have like, yes, journeys need to be one-on-one in that particular place, but essentially telehealth is important for, we have like people raising hands in the emojis. Can we see that? Can we see those?
We can in the participants on that side,
Okay.
but
Yeah.
I think there's just a question about clarification. Are we asking telehealth appropriate for the integration aspects, both pre and post?
Yeah, pre and post,
Why
or
don't
at the
we?
very least, evaluation. I know that that's just, it's just, mostly it's like, what I'm hearing is we need to be careful about saying telehealth for journeys. And journeys means administering and facilitating one-on-one medicine with the people. That's a core of what we need.
I heard earlier, and I agree with, that not the integration as well.
Not the
So
integration. Okay.
preparation, all the screening, cool, telehealth. Um,
Okay.
the administration session and the therapy or integration, whatever that ends up being, um, not cool.
Okay.
Can we have a
So
vote on that?
yeah, evaluation only, not to say that it couldn't possibly include the integration, let's just say, but just at the very least, telehealth evaluation is important, right? And that integration, I'm not sorry, telehealth is important, and that the facilitation should be at the very least one-on-one. Got 4, 5, okay. And I know that's really hard, so that's fine if, you still need time to think about it, because there's, especially for people who are not quite versed in what this looks like, it might be a little bit hard, but I just kind of wanted to see based on visually. Telehealth is telehealth for evaluation, journeys facilitation should be one-on-one. All right.
And just to clarify, this is not a requirement that those therapy aspects be telehealth. It's just that it is an option, not a requirement. There
Yeah,
are
we're
many
not
people who prefer in person.
yeah, no, yeah. That's also another thing. Language is very important. We need to kind of I just kind of wanted to see where people were at as far as, and we're not voting really, like, it's not like an official vote. I just wanted to see where people were at. I want everyone to contact the email with any other concerns and suggestions. I know some people don't like speaking out loud, but are better about writing. That's great. Sending this information for other people. My suggestion is subject line with the committee meeting that you were at, the date, maybe just a little blurb, telehealth or something. Just that way, it will really help to kind of pinpoint what the subject is that you want to talk about, or the concern or the question, which is, I think will help with with just understanding where we're all at. Thank you so much for this. Again, there's going to be another meeting on Wednesday, the 7th from 5:30 to 6:30. So if you wanted to continue to have a conversation and or tell other people who weren't able to come today, I know it's the holidays. I do appreciate all of the opinions and concerns that we all have throughout. Thank you for taking the time and your patience with me and with everyone as we're figuring out what we need to do to move forward with our the board and our committees. If there are other concerns, like I said, just I really want us all to be able to formulate what we need to talk about. And even if we don't get into the weeds just today, you know, making sure that we have that. This is very, very important to me. All of your concerns are very, very important. We need to hear them all. So thank you so much. I appreciate it. I don't know if there's any other things, but you're free to go.
Thank you to everybody, and Happy New Year.
Happy New Year.
Thank you, Desba. I will now be ending the event.
Thank you.